Experience an EHR like never before with Emma, the system built by ophthalmologists. Document quickly and draw with complete freedom. Plus, unify your records in the cloud with integrated image management. Visit booth 4017 to see for yourself.
Hi, I'm Rachel Kopczyk, and I am here at AAO 2016 in the exhibit hall. This is the largest exhibition of ophthalmic products, technologies, and services in the world. There's also an opportunity for you to learn when you're here inside the exhibit hall and watch live presentations. You can also try out some of the latest diagnostic systems, such as this one, which creates a topographic image of the cornea that can also be used in your laser systems for a customized refractive surgery. One of the other benefits of being right here in the exhibit hall is you can practice with the latest tools and technologies for cataract surgeries with experts guiding you through the process.
It's my first time actually, and I'm very impressed by the scale and by how many visitors I see.
Here you have everything. I came here every year.
If you want to map out your exhibition experience, you can do so two ways. One, by coming right here into the exhibit hall by the main entrance and use the interactive monitors behind me, or log on to aao.org and click on the virtual exhibition hall. Electronic medical records are helping to streamline ophthalmic practices, but can also put you at risk. Dr. Ravi Goel discussed ways to protect yourself in this session at the Technology Pavilion, which offers succinct presentations right on the exhibition floor. Dr. Goel said everyone from small physicians' practices to large hospital systems which use EMR are being shut down by ransomware. This means patient and billing data can be compromised at the expense of thousands of dollars per day.
What they can do to minimize the risk is to have a strong IT team and an action plan, and having network segmentation. It's easy to do, easy to research, and easy to implement.
I want to make sure we're doing everything right in our office. And he was really good, a lot of nuts and bolts, to go to healthit.gov, which I am going to do. So we're going to have an office meeting. I'll have my office manager do all this also, and we're going to have a re-education of the entire office, because I can't imagine anything worse than walking in one day and your system's locked down due to these jerks that do stuff like that.
The Academy has launched a new patient storytelling initiative. Here to tell us a little bit more about it is the Academy Secretary of Communications, Dr. Philip Rizzuto. So tell us, what is this initiative all about?
The initiative is a new part of the branding engagement program that we at the Academy put together so that our patients and our members understand we as ophthalmologists protect sight and empower lives. We want to share what we do. We want people to understand the power of we as physicians can provide sight-saving initiatives to our patients, but what we want is their stories, and we want to hear how that has affected their lives. So our patients telling us what we do, why, and how it's affected them.
And do you have a story from a patient that's affected you?
So just recently, I'm an oculoplastic surgeon, and I have a patient who has thyroid-related eye disease, and that thyroid disease was complicated by the fact that he smoked. And one of the leading problems with thyroid eye disease is smoking, which has long been proven to make thyroid eye disease worse. Quite simply, he stopped smoking. So by stopping smoking, it obviated, or he no longer needed my intervention from a surgical and or a medical standpoint. But think of how wonderful it was, because I explained to him the seriousness of that. He stopped smoking, his medical condition, clinical condition, breathing, overall health improved.
And how does that make you feel, though, as an ophthalmologist? It's got to help make you feel really valuable and great about the work you do, right?
Think about our storytelling initiative. We're protecting sight and we're empowering lives. This person's life now is better. He can walk better, he can see better, he feels better. By the interaction that I had and some of the care that I provided for him.
Now, you guys have also launched a new PSA about the importance of getting an eye exam. What sparked this PSA?
We really want people to know how important it is to have their eyes examined by age 40. We have a brand new animation on our website, AAO.org, talking about the importance of getting an eye exam. There's so many diseases and so many problems that can affect the eye. An eye exam can pick them up.
And it's all about being preventative, especially in this field as well. And maybe that word isn't really out there to the public. So what else can ophthalmologists do to help spread the word with this PSA?
So the PSA is on our website, AAO.org, but it's also associated with our Facebook page and on our Twitter account. And our members can go to our Facebook page, go to our Twitter account, and go to our website, AAO.org/iSmart, and link and share and talk about these stories so that other members and their patients can hear about this PSA, watch this PSA, and understand the importance of an eye exam.
Thanks for your time.
Thanks for having me.
Here inside the Learning Lounge, you can attend sessions throughout the day on a range of topics, including this one from the Young Ophthalmologists Committee on ways to incorporate social media as part of your business practice. If you're not using social media for your business or practice, you should be. 75% of Americans are using social media daily. It's an excellent way to share information with your current and future patients. Some pearls on how to utilize social media include following the colleagues you meet here at the annual meeting, sharing informative posts from professional sources such as AAO, and
really giving quality over quantity. So providing quality personal posts that are applicable to their patients, the local community, but really focusing on the quality of your posts.
You're advocating whenever you post something to social media. And so it's important to recognize that we just need to actually step out a little bit from our comfort zone and advocate for our profession. And that may be by advocating for our patients and encouraging patients to understand common eye diseases or understand common pitfalls that can affect their eyes or things like that, of that nature. Or it may be actually advocating for our profession.
Lean is actually, in a way, a very simple philosophy. It essentially says, identify what your customer values.
the customer being your patient. Lean is the exciting science that can help you put the focus back on your patients and make their office visits more efficient and effective. With Lean, you do that by removing the waste. That means figuring out how long it takes a patient to check in, screening time, anything that takes away value from the patient.
We've streamlined the check-in and check-out process so that now when the patient checks in, their copays and deductibles are taken care of at the check-in desk. The largest project that we've rolled out Lean with is our conversion from paper records to electronic health records, and we've seen substantial improvements financially with implementation of electronic health records in a lean fashion.
It saves physicians, the staff, about 30 minutes per clinic session. So that reduces overtime and gets people out of the clinic so they can get lunch in the morning or get home on time. And last but not least, it just changes the culture where staff, physicians, and patients all experience a great environment and a great experience getting their eyes taken care of.
I'm Rachel Kopczyk here at AAO 2016, and the Cataract Spotlight session is, of course, very popular, and here to preview it with us right now is Dr. Mitchell Weichert. And why don't you give us a little bit of a preview on the changes that you've made? We now know that the speakers are going to get 7 minutes to talk and really cut to the core of their advice. So why did you make that change?
Well, it's always good to shake things up a little bit. We don't kind of want to keep having the same format year after year after year. So we do move things around and shift it from year to year. This year, each speaker is focusing on their top 5 pearls for different challenging situations in complicated cataract surgery. So we hope that the audience will walk away with a whole bunch of pearls to put in their toolbox so that when they get back to their practice and have a difficult case, they'll have more to draw on to help them with that case.
And can you give us a little preview maybe of some of those pearls of wisdom or some of the topics that are going to be spoken about?
Well, there's things like cataract and uveitis, cataract surgery in glaucoma patients. There are certain kinds of cataracts like posterior polar cataracts, and some typical examples of pearls might be Don't hydrodissect, maybe hydrodelineate when you're separating the nucleus. Minimize your nuclear manipulation. Save that cortical removal till the end, and before you do that, use some viscoelastic maybe to viscodissect the cortex off. So the very last thing you do is disturb that posterior polar element of the cataract in case it's stuck to the capsule, so you avoid capsular defects, or if they're going to happen, they happen very late in the case when they're much easier to deal with.
That's great. And what are you looking forward to within the Cataract Spotlight? Do you have anything in particular?
Oh, I mean, I enjoy the whole thing, and at the end it's always topped off by the Kelman Lecture, which is given to one of the innovators in cataract surgery. This year our Kelman Lecturer is Dr. Roger Steinert, and we're looking forward to a really exciting lecture from him on his contribution to cataract surgery.
Great. We look forward to hearing those pearls. Thank you so much for your time.
Thank you.
It's a disturbing statistic. Half of avoidable global blindness is due to cataracts.
As we know, cataracts are still a leading cause of blindness, and you think with all of our resources and all of our education that we should be able to tackle that problem.
The Academy's Global Education Outreach Committee brought together a lineup of speakers to discuss ways to conquer this problem. One takeaway was that the guidelines and rules for safety in cataract surgery apply everywhere.
Whether you're in a very rural operating room in the middle of a very remote area, or whether you're doing more modern surgery in a developed operating room in a developed country. And that is to pay attention to all of our guidelines related to patient safety.
Another highlight was the steps the World Health Organization has recently taken.
We convened several sessions with our member states and worked collaboratively on developing a global action plan for eye care, which is now in operation for the next couple of years. So that was the first move. The next thing we did was to start a series of assessments of national eye care service in various countries. We have covered now more than 40, and that number will grow, so that we better understand what the needs are, what is in place, human resources, finances, how the eye care gets financed, and what are the needs to address.
More information about the Global Eye Health Action Plan and the Eye Care Service Assessment Tool can be found on the WHO website. I'm Rachel Kopczyk here covering AAO 2016, and I'm joined now by Dr. Cynthia Bradford, who is the Academy 2016 President-elect. What are you looking forward to with your presidency next year?
I'm looking forward to meeting a lot of ophthalmologists all over the country. I learned so much from ophthalmologists. This session, we had a wonderful meeting. And it was a first for the Academy, where we brought medical students, first and second year medical students who are interested in ophthalmology. And what we selected was underrepresented minorities to help bring them into our fold. We need to have more underrepresented minorities become ophthalmologists and serve their communities. And it was a fantastic session.
How important to you is it to bring in that future generation of ophthalmologists?
Oh, I think it's critical because the demographics of our country is changing, the demographics of medical school is changing, and there are truly some disparities in medical care and eye care by the minorities in our country. Diabetes, glaucoma, and with cutbacks in Medicare, some of those minorities with these problems are not going to have care. What we can do is so wonderful, and we just have to get to the patients, and we have to take care of patients efficiently, cost effectively, so it gets more and more difficult as we move on, because we can't move slow, we have to move fast, we have to move efficiently, and we have to deliver a great quality of care to all patients.
You're going to be the third woman in 120 years to be president of the Academy. So does that mean anything to you?
Well, it's a great honor, first of all, to be the president of the Academy. I never ever thought about this position. And of course, it's an honor to be the third female. The first two females, Susan Day and Ruth Williams, are just fantastic people who are great mentors and are great models. We're all ophthalmologists, and I hope someday it won't make any difference if you're a male or a female. You pick who's the best for the job, and that's who's selected.
Well, congratulations. We look forward to your presidency next year.
This is our livelihood. This is what we do. We're going to be in this for a long time. And so you really want to be with someone who's going to be with you.
MedFlow, developing the future of eye care through client-inspired products. Come visit MedFlow booth 1635 to learn how you can become a lifelong partner.